Do you feel that you have more freedom to practice or to find new and innovative things here, as opposed to being in the United States where...
Yes. Yeah.
Okay, that makes sense.
Yeah,
so you're more apt to find something that's going to be life-changing.
Well, we're more like able to look at things that might not be currently accepted by the majority of physicians. We look at things sometimes and we find that there is no benefit from it, and we come out and say, well, we didn't find that it was helpful at all. And that was our clinical experience. Meanwhile, another clinic somewhere else may have found the same treatment to be beneficial, and that's
I don't
just...
think I've ever heard of a doctor saying that they made a mistake.
No, but it happens all the time, I mean, if we try something, but most of the things that we're trying, and when I say try something, if there's a study that comes out and says curcuminoids from the spice turmeric suppress the, and there is a study like this, suppress the tumor stem cells from activating, then wouldn't it make sense, although there is no clinical study yet, to show that in between rounds of chemo, if you give people curcuminoids, it will keep the cancer stem cells suppressed until the immune system can recover, so that when they go for chemo round again. So you wouldn't want to necessarily take the curcuminoids while you're getting chemo, because you want to try and entice those cancer cells out of the stem cell state into the active growth state where they will be targeted by the cancer. But in between rounds, we can use that. So rationally using, this is why it takes a whole lot of knowledge, to understand when and how to use nutritionals in the cancer program, and it needs to be an integrated approach. And although there isn't a study yet to show that definitively giving patients, curcuminoids in between chemo rounds improves the outcome, based on the science that we know that curcuminoids can suppress the tumor stem cells, it is reasonable to go ahead and recommend that, because there's no side effects to giving the curcuminoids.
And it strengthens their system.
Well, it does many things. Curcuminoids will do many things, but we're just talking about that one specific action, because curcuminoids do many things. But the one specific action, it makes sense. So, because you were asking about, do we have the freedom to do things? A doctor that's in a very structured environment, be it an academic environment or some insurance managed care environment, is not able to step outside and say, I'm going to use my brain. I'm going to use my brain to say, I read this study where it showed that curcuminoids suppress tumor cancer stem cells, and I'm going to tell the patient to take this in between the rounds of chemo. Because there's no study to definitively prove. That study will be done, believe me. It will be done. It isn't done yet. But should I wait until that study is done before I can implement that in my practice is the question. And I am fortunate that I am in a place that I can implement those things in my practice ahead of, in advance of, the standard medical practice.
That's absolutely amazing. I think that more people, if they heard or they understood or they had this information, would be more apt to seek out alternative treatments instead of just what they're going to give them.
Maybe someone, if one person watches this video and it changes their life, then it's worth every cent.
Well, you've had some wonderful, insights to give us that we've never heard before. So, thank you very much for